Today, we are going to talk about measurements for diabetic patients. What measurements need to be done to monitor the health of a person with diabetes?
There are several key measurements, for example, fasting blood sugar level, postprandial blood sugar level, and hemoglobin A1C. In addition to these three important measurements, we can measure blood pressure, cholesterol, and triglycerides. It is also good to check kidney function and perform eye exams since these may help detect and treat any problems early.
Thank you for letting me know. Isn't it sufficient to use hemoglobin A1C to monitor the current condition of a diabetic patient?
Hemoglobin A1C is an important measurement to monitor the average blood sugar level for the past 2 to 3 months since the lifespan of normal red cells is about 3 months. However, it does not detect the variations, ups and downs, during the past 2 to 3 months.
Aha, even if the average blood sugar level was moderate, blood sugar levels might highly fluctuate within 3 months.
Yes, the high variations of postprandial blood sugar levels reflect blood sugar spikes, which is not good for diabetic patients. It does not detect the variations, ups and downs, during 3 months.
Are there any other cautions for hemoglobin A1C?
When the diabetic patient had anemia or pregnancy, hemoglobin A1C might not be accurate. It also depends on age, overall health, and potential for complications.
I understand that there are multiple things to consider. What is the target A1C level?
The American Diabetes Association recommends that most people with diabetes aim for an A1C level below 7%. But, a normal A1C level is below 5.7%. A level of 5.7% to 6.4% indicates prediabetes, and a level of 6.5% or more indicates diabetes.
Oh, making the A1C level below 5.7% looks difficult to achieve. Is it possible to do it?
It would not be easy, but it is not impossible. Having a positive attitude would be helpful for better results.
I agree. Is there any way to help in terms of lifestyle or food selection?
As a matter of fact, lifestyle and food selection are important factors to improve diabetic conditions. For example, exercise, eat a low carbohydrate diet, reduce stress, quit smoking, and reduce alcohol drinking. Skipping dinners for a while is also an option to consider.
Skipping dinners? Do you mean intermittent fasting?
Yes, intermittent fasting with skipping dinners may give diabetic patients better sleep quality and an opportunity to heal their digesting organs due to fasting time. Another important benefit is losing weight, which is linked with reducing visceral fat and decreasing blood sugar levels.
That's good. Reducing visceral fat is a desirable benefit. Why does skipping dinners reduce visceral fat?
Skipping dinners may generate a shortage of carbohydrates that are the source of glucose. Low glucose level triggers pancreas alpha cells to secrete a hormone of glucagon. Glucagon makes the liver convert stored glucose, glycogen, into glucose that is released into the bloodstream. When glycogen is not available anymore, visceral fat begins to be converted into ketones, which are alternative fuels for the body. This is also related to a ketogenic diet.
That's good. Reducing visceral fat is a desirable benefit. Is it always good to skip dinners?
Skipping dinners is generally good for diabetic patients. However, diabetic patients need to be careful about hypoglycemic shock, also known as diabetic shock, which occurs when a diabetic patient's blood sugar drops extremely low. If a patient feels dizzy or uncomfortable after skipping dinner, it is important to work with a healthcare provider.
What blood glucose level can make diabetic shock?
Generally speaking, when the blood glucose level is less than 70 mg per deciliter, patients should be careful of diabetic shock. But most people do not experience this due to skipping dinner. It is a good try to make it better.
Thank you for some options to try, and careful comments regarding cautions. If this video helps the audience, I would like to ask them to subscribe here and watch other related videos. Have a good one. See you soon.